Hello and welcome back to the Advancing Healthcare Innovation Show. I'm your host, Michael Stamatinos. And if you're new to us, man, we're really excited to have you here because we're having some earnest and sincere conversations with leaders within our space that are painstakingly shaping the future of healthcare. We're really passionate about a few different things. We're passionate about leadership, access, innovation, and adoption of these innovations. And if you haven't checked us out, make sure that you hit the subscribe button now, wherever you are, to have any of these new interviews come right to you. So let me just, it's your first time tuning in, let me just kind of tell you a little bit about what we're doing here, the purpose of this is. So our focus is bringing real stories of innovation to life, not just the glitz and the glamour, the learnings as well. And we want to give these folks that are coming onto the show the space and the platform to be able to share their stories with our community and ultimately with the world. So we've had an amazing action-packed year of guests. So you can always check those out in our library. And as I mentioned, new episodes come out weekly. So make sure you check them out. So our field is fast evolving. Things are always moving around. Things are changing. And it's really critical to have leaders that not only can envision the future differently, embrace innovation eagerly, but also address a lot of these pressing challenges that we're facing right now. There is no shortage of issues. So our next guest is one of these types of leaders that's taking things on. So I'm thrilled to have Ben Tingey, the Director of Innovation at Advocate Health. Ben's really pushing healthcare into new territories, changing how we think about it, improve the care that patients are receiving. He's really committed to solving complex problems, helping others reach their full potential. And on his strength finders, because I'm a strength finders geek as well, his top qualities are restorative, developer, and empathy. So we'll touch on that. So whether he's been leading cross-functional teams, researching provider burnout, or managing the Amazon AWS partnership programs for social impact, or even sustainability and greening the OR, or designing new consumer-centric care models. Like Ben's at the forefront of all of those things. So his actions really reflect his love for people, for helping people, for being genuine, and having a passion for transformation. So in this conversation, we get to explore a lot of these stories. We get to explore some insights and learnings that have shaped Ben's career. So Ben, great to see you. Welcome to the show.
Thank you so much, Michael. Great to be here. Very generous introduction. Look forward to the conversation.
Yeah. So I mean, listen, you've been described as like a connector and an innovator, and it's nice when connectors get to connect with other connectors. So it's sort of the amplification of superpowers. But was there a defining moment earlier in your career when you kind of realized that these were your superpowers?
That's a great question. I definitely had a moment where I realized that I wanted to spend my time doing innovation. Um, I was in my graduate program in healthcare administration, a wonderful program at George Washington University. Loved my professors, loved the program. But while I was in my classes, I would often think, man, there's got to be new and better ways. And at the time, I was at the same time I was in graduate school, I was also interning for a startup company called Privia Health. At least it was a startup when I was
Yeah.
there. They've since grown significantly. And I remember just the feeling that I had working there and the pace and the energy and the excitement that like we're building something, we're changing healthcare, we're making it better. Um, I loved the pace, loved the energy, and was like, I want to do that type of work. And so that sort of is what piqued my interest and set me on that path, and have been trying to find that buzz ever since.
Yeah, it seems like, there's like a fine line of like that tension where you're moving super fast. There's a level of creativity. There's an earliness to doing stuff where maybe there isn't a structure, so you're having to create these structures. So like I said, there's, for me, we were created by a creator to be creative. And when you can get into those zones, it's really fun. How do you do that in such a big organization like Advocate Health? Because it's
Yeah.
not a small organization. So is your team like a small startup within a big organization? Like talk to me through that. Like, or for those that are kind of interested, share a little bit about that.
Advocate Health is a big organization. It's north of 30 billion in revenue, I believe. I think we're the second or third largest not-for-profit in the country, with facilities in, I think, 6 states. Very large. Do we operate as a startup within a large healthcare system? I'm not quite sure. I feel like, at least historically, how we've described ourselves, at least on a previous team, was that we were the Innovation Sherpas, where we were helping teams, helping leaders through the innovation journey. That we were the Sherpas who had some experience on the terrain and knew some of the tools and frameworks, but really we were there to serve and lift and help those leaders internally who were going through the challenges. I think that description is still apt. I think I could probably add, you mentioned the word connector. I think our team spends a lot of time facilitating connections, whether that's relationships or introducing new technologies, um, getting involved in new ecosystems, that connecting relationship, the connective tissue that we're trying to build between ideas and systems and people. That's probably a good way to describe our work as well.
I love Sherpa because you're doing a lot of the lifting. You've walked the path before. Listen, innovation is definitely a buzzword, um, and yet so many times initiatives fail. How how do you, your team, how do you guys view failing? What is that like inside of the organization?
Yeah. Um, Despite, well, as you said, innovation is a buzzword. Failing fast, I think, became a buzzword a few years ago as well.
Yeah, yeah.
I'll be honest, failing is never very fun. And
It's
yeah, I
not.
guess we should strive to push the envelope and get to a point of failure because that means that you're really charging forward and pushing and going into new territory. Um, and there's always things that you learn from failure, but it also has consequences.
That's right.
And I think there's a recklessness that is sometimes seen as a good thing in some circles, maybe more in the tech industry. In healthcare, because we're dealing with people and their lives and their health, recklessness is not something that is allowed. Uh, and so our approach to failure is more about, um, are we being wise in the preparation and in the scope, and are we getting the right people involved? Are we doing it ethically? Are we doing it
Right.
wisely? Um, and if we have brought in all the appropriate inputs, done it the right way, followed the evidence, followed the frameworks, and it still fails, then I think that's very different. That is okay, because we've learned maybe there are things that along the way we missed in terms of not incorporating the patient voice in the optimal way, or maybe there was some policy change or something that happened in the external environment that ended up shaking up what could have been a better result. Um, I think resilience is maybe the lesson that we learn from all of that is that I can't remember who said the quote, but enthusiasm or optimism is moving from or success is moving from failure to failure without any loss of enthusiasm. And so I think that maybe Sherpa mentality of like we're going back
Yeah.
up the mountain and then we got to come down the mountain. We're going to go back up and we're going to go back down and we're going to maybe take a different route next time because we found that there was a crevasse or there was avalanche over here. And so um, that resilience to just get back up and dust yourself off and keep trying.
Any particular setbacks that you've had in this journey that like stick out in your mind in terms of what it taught you about creating meaningful change? Any stories that you can share
Yeah,
publicly? Publicly?
yeah. I'll share this one carefully. My favorite project of my career was an opportunity for us to develop a almost like an urgent care, primary care uh, clinic for the Hispanic community, the Latino community in Charlotte. I'm fluent in Spanish. I've spent a lot of time in the Latino community. Um, and so I was on this project and I was able to incorporate their perspective in the design. I mean, we involved them in design sessions. We did interviews in their homes and places of business, often in Spanish, about their healthcare experiences and what went well and what didn't go well. Um, we set up this neat prototype in the YMCA of what the clinic would look like and what some of the processes would be. And we invited people to come and actually experience it in this prototype version. And we had all this great feedback, and we were so confident that we were building something that people wanted, that they
Right.
needed. And due to some internal things that happened that I won't really go into, um, the it was never able to actually get implemented. And so, and there again, there were reasons for that. I'm not going
Yeah.
to dive into it, but for me, that was a frustration because it was something that was so personally fulfilling
Mm.
where I felt it was like the perfect match of my skill set, my experience, and the things that I love to do and the impact I wanted to have. But then this inability to have it, go across the finish line. To even today, I still have just like, oh, like that was the one that got away that I wish we could have figured out a way to land that plane. Um,
Do
but
the
the lessons we
patients, the
learned.
people that you have relationships with in the community, do they still ask you like, hey, whatever happened about that?
That, yeah, there were some people that did ask about that, and there are other things that our organization has done in terms
Right.
of great outreach for that community, um, uh, and so a lot of the lessons weren't lost. We were able to apply them in other areas, but that particular thing, just because I had so many fingerprints on it, was one that like, oh, I wish I could have been able to see that through all the way to the end.
It's your
Um,
baby. There's a sense of, hey, this you put in a lot of work. You want it to go well. You don't set out to have something not go well. The intentions are for it to go well.
yeah,
Question for you, when you think about that, about success and maybe like success metrics, what metrics do you focus on? What metrics matter? Aside from, you hear about ROI. Um, wh- what are the metrics that you and the team look at when you consider something to be a success?
yeah. Well, as a team, we are looking at how well we are amplifying the impact of our service lines, of our innovation network, of our facilities, of our leaders, and so we're measuring ourselves on how well we are supporting them in their goals. We certainly have metrics related to yeah, it's obviously project specific, but if there's a revenue target or a cost target, or if there's um, uh, new technology you're trying to implement, how quickly are we moving it through the process to get approved and all of that. And we're thinking a lot about the reputation and gravitas of our organization, and are we being a good partner so that future partners or startups or whoever see us in a good light and want to work with us. But I'm going to take your question in maybe more of a personal way. Like, well, what are my personal metrics of success?
Yes.
I'm I've been very influenced by the work of the late Professor Clayton Christensen, and he
Yes.
wrote an amazing
Look
book.
what I got right here.
Is that How You Measure Your Life? Oh, that, yeah, the Innovative Subscription. That's an
Okay. Okay.
amazing
I
book.
wasn't sure if that one. Okay.
Yeah, but one of his, I think, the book that probably most communicates who Clay was and what he was really about is the book How You Measure Your Life. And in it, he talks about, and Clay was a very accomplished professor, thinker, writer, consultant. He ran a business at one point. I mean, there wasn't anything that he did, he didn't do it at top levels. Um, but he said that what was most important to him was the people that he influenced and impacted along the way. And And you mentioned my Strengths Finder profile. A developer is my probably my top strength, which is um, and I'm not going to articulate this perfectly, but essentially it's uh, coaching, mentoring, teaching other people.
Yeah,
That's where I drive my most personal satisfaction, but also what I enjoy doing the most is seeing light bulbs go on in people's eyes, or making a connection for someone that is meaningful, or helping them in some way that helps them grow and learn. That's really what fires me, um, and so yeah, finding opportunities where that metric of success, what are the environments, what are the projects that have that direct impact on people?
yeah,
And that's what drives me is, am I making a difference in someone's life in terms of their health or their sense of self and self-worth? Do they feel love from me? Um, and so, yeah, that's like how I help other people grow and learn. That's what's most important for me.
that's leadership, man. That's leadership. That's seeing something in someone that they don't necessarily see, and you being able to pull it out of them and say, "Look, this is how I see you. You might not see yourself like this. This is how I see you." And it's really cool because I there have been a few teachers and a few mentors in my life that have been very impactful. And sometimes once, that's all it takes. One thing they say, one thing they point out that can completely change the trajectory of your life. And that's really awesome to see. And along those same lines, as you talk about being a developer, you framed a few concepts that you've organically grown. There maybe some through some process improvements. I want to maybe spend a few minutes on the external innovations that are trying to come in. And how do you develop those? How do you come alongside of some of these emerging companies? Admittedly, many of them are not ready to work with the advocate helps of the world. How do you develop them? How do you shape them to be ready?
Yeah. There are so many things that I've learned from my team that I really can't take credit for some of the things I'm about to share, because these are lessons learned and expertise that's been gained over years of hard work, and so real, huge credit to a lot of people on my team and things that they're teaching me, especially over the last couple of years as our work is oriented more towards, as you said, kind of ecosystem partnership sort of stuff. Um, one thing that we talk about as a little bit of a metaphor, uh, there's a great movie. It was a book first, and it became a movie with Matt Damon. It's The Martian. So it's the astronaut who gets stranded on Mars
Yeah.
and has to figure out how to survive until they can come rescue him from Mars. And um, there's a scene where he's out working outside of the little compound that he's created for himself, and he has to walk in this decompression chamber or something that basically filters all the um, toxic air or whatever out, and then he's able to walk in and close the door. There's all the oxygen on the
Yeah.
inside. So we have described our team has sometimes described ourselves a little bit like the decompression chamber, helping the external partners work with the organization, where we're translating, if they're saying this, what people how people would understand an organization is if we say it this way,
Yeah.
or we're working with startups. They're accustomed to maybe a certain pace, or maybe they're accustomed to 80% is good enough. Sometimes 80% is not good enough at a large organization like ours, and so we can help, like, you actually have to follow the steps and complete these forms and show us the certifications and show us the impact and the measurement and all those things and how you did it. We can't just like take your word for it all the time. We gotta be really serious about how we proceed
Yeah.
through the steps. And so, playing that role where we're, both uh, advocating and protecting our um, advocate health interests and what our leader goals are and strategies and objectives, while also advocating and wanting to help this external partner who has some capability that we need
Yeah.
or want in order to reach a new destination that we haven't been able to achieve before. And so finding ways to get everybody together to talk the same language, that takes a lot of work. But um, I was also thinking just before our call, I took my boys to see the Mufasa movie, and there's a great song. I think Lin-Manuel Miranda wrote the music for Mufasa, and I think in the song they're actually quoting an African proverb or something. I'm not really
Hmm.
sure what the attribution is, but it's if you want to go fast, go alone. If you want to go far, go together. And I think our health system has really understood that there are lots of things that we can do by ourselves and we can move quickly and innovate and make some progress. But if we want to really achieve the types of things that we aspire to achieve and the kind of changes that are, frankly are desperately needed in healthcare,
Yeah.
have to do it with partners and with ecosystems and coalitions and alliances. And so we're learning how to do that and um, are excited about the things that we'll be able to do together, how far we'll be able to go.
Yeah. You mentioned something that triggered a thought, which is, look, there's a lot of issues that we're trying to solve, and this notion of endless problems. How does the team, how do you decide what's worth your time? What's worth your energy expenditure and resources and energy? What does that framework look like? How you decide?
Yeah, we do have some, I would say, formal evaluation criteria where we are looking at opportunities and then we score it based on criteria. And I'll share some of those things. I mean, there's a lot of it is a check on strategic alignment. Is this something aligned with one of our long-term goals or um, some of our initiatives or promises that we've made? So there's an evaluation where we're looking at alignment in terms of sponsor alignment, strategy alignment. Um, uh, does it build on something existing or is it, net new? So those are some of the questions that we're asking, and we're giving those
Mm,
a score. And then the other dimension that we're evaluating is what we call operational readiness. And this is where we're looking at, do we have the capacity? Do we have the funding? Do we have um, the will you know, to work on it, to see it through? Uh, and then, and there are other things as well. I mean, there are intangibles that you also have to consider, like, because sure, we sometimes pursue things that maybe aren't in like the top right or top left quadrant or whatever from whatever
yeah.
matrix we're creating, but there's something about it that has that intangible, that there's some gravitas to it, there's some opportunity that we see, or there's uh, some stakeholder that is important to us, and so maybe there's something small that we do with them now that we believe will later turn into something even bigger. um, so it's definitely a mix of science and art,
Okay.
and I think innovation is that way anyways, is you have to blend a little bit of both.
It definitely is.
And um, but it's exciting. I mean, I think with the growth that our organization has seen, with the leadership that we have, there's a lot of neat stuff that is inbound that we see, and there's so many things that we could do. We can't do all of them, but the ones that we pick, we're really excited about.
So what's on your plate right now? What's on, if we were having this conversation fast forward a year from now, and we look back and you're looking at what's on your plate, what's like the one or two things that you're like, man, I get that done. It's a great year. What are those things?
We've been very closely connected with Cancer X. It's a public-private partnership aimed at accelerating technology solutions in the fight against cancer. And one of the programs within Cancer X is a startup accelerator program that sources amazing startups who are tackling a whole host of different things related to cancer care. It could be advancing clinical trials, it could be experience and survivorship, it could be care navigation, addressing financial toxicity. There are a lot of things that we could be working with, and
Mm,
so um, that program we've been supporting closely now for a couple of years, and that cohort, probably by the time this episode is published, the cohort will be announced, and we'll start working with those companies and mentoring and coaching them through the accelerator program, and then seeing what opportunities there are, for potential pilots or research studies if that's a fit. But that's a program that is just really exciting. Cancer is such a I mean, everyone has been impacted by
everyone,
cancer at some
everyone.
point, whether it's a family member, close friend, or and it has a very sort of visceral, um, yeah, it's a very unique disease, and so seeing the innovations that are coming from these companies is just inspiring, and being in a place to try to give those startup companies the best opportunity at seeing if there's a real opportunity to address that either through a health system like ours or through
Mm.
others if we can facilitate that, and just a really exciting program to work on. So that's a big one for 2025 that I'm focused on. Um, some other fun things in the works. I've been connected with our environmental sustainability team, a lot of neat stuff there, and so much opportunity to make an
Right.
impact. Um, so yeah, there's a lot of cool stuff in the hopper. So maybe have me back on in a year and
That's that's
learn
that's kind of
more
what I'm
about
thinking.
what we've
That's
done.
kind of what I'm thinking. I know we're rounding out close to the end of our conversation, but there's a few things that stick out in my mind. So we've covered going up and down the mountain, right? We've covered the ability to have resilience and hearing no from key projects that you're working on and things don't end up working out. I'm just curious, just around this notion of innovation fatigue. How do you personally guard against innovation fatigue for yourself and even for your team?
Innovation fatigue is real. I've felt it. I know others have experienced it as well. Uh, like I said, developing that resilience is key. Um, yeah, I'd say uh, one of the things that is motivating and in a way even healing is uh, involving patients as much in the process. Real people with real stories and being able to link the things that you're doing to real people, that changes the game in terms of keeping up your stamina and your focus on different projects and the things that you're working on when you see the impact that it's having on real people and on their families and on the community. Um, there's a lot of bureaucracy that you can be patient with when you
Mhm.
know that on the other side of it there's um, there's a person and a family that's going to benefit from it. Um, and I'm a big advocate for involving patients, involving clinicians, whoever the end user, whoever the consumer is of whatever you're building, in the process from the beginning. And I think not only does it align incentives and align the design of whatever you're building into something that's valuable
Yeah.
and that nails a job to be done of some kind. Like I said, it also guards against some of the innovation fatigue that can set in when you've gone through, committees and other things and approvals. Uh, and yeah, but people, that's the purpose and the motivation.
All right, so we're gonna end up with a little bit of fun here. We'll do some rapid fire questions. I'm going to give you some
Yeah, let's
one
go
word
for it.
answers. Give you give me some one word answers here. So innovation is fill in the blank.
Exciting.
Healthcare is
Love.
hmm, failure is
Sucky.
success is
Um, this isn't one word. Maybe hyphenate it, but a team effort.
we'll hyphenate that for sure. And then lastly, what do you think is one commonly accepted sort of healthcare innovation idea that you think is like very overhyped or misguided?
Ooh, overhyped. Um, um, wow. I have someone joining me here.
It's fine. Don't worry about it. It's all good.
Oh yeah. Um, give me just a couple minutes. I'll be right there. Okay. Thanks, big guy. I have, for the listeners, I have five boys, and so sometimes
It's
they
all
come in
good.
like here at home. Something that's overhyped. I don't know if there's necessarily a technology or an innovation tool or process. I think so many of them have their place. I think what is often overhyped is, um, I would say, some of the personalities that maybe attract a whole lot of funding and a whole lot of attention, but maybe don't have as much substance behind the curtain. Um,
Yeah.
And I think, real innovation is not the theatrics, it's not the hype, it's people making an impact on people. Um, and some of the best innovators are some of the more uh, less conspicuous, or the people that are the glue behind the scenes actually making things happen that aren't getting recognized at conferences or with loads of venture capital money. Um, that so often the real innovators are people with big hearts who are finding ways to serve in their communities and make a difference in whatever capacity they have. And so I think um, let's hype that work, the daily grind that's needed to make people healthy on a daily basis,
That's right.
um, and some of the big names, the big companies, and the big dollar signs associated with the healthcare industry. We need investment. We need brilliant people to come and bring their ideas and make a difference. Um, but the net impact of the millions of people who are doing small and crucial things every single day, that's I think where the real value is brought.
We're so aligned, it's not even funny. How can people, Ben, how can people follow you, your work? Maybe just kind of give a little commercial for yourself for Advocate
Uh,
Health and how they can kind of follow along what you and your team have been doing.
yeah, definitely. I used to have my own podcast. It was called a Sherpa's Guide to Innovation. So there's the Sherpa
Love
name.
the Sherpa. Love it.
Yeah, and you can use that one. Yeah. Sorry, everybody.
It's
I
all
will
good.
hold just a minute. On just a minute. Um, you can find me on LinkedIn. Our team is doing amazing things, and so if you find, I'm just one of a team of people. They're all doing amazing things, and often way better than I am, and so I really want to lift up my team. They're amazing, and so if you go on LinkedIn and you see other people on the innovation and adventures team at Advocate Health, reach out to them. We'd love to connect. Um, and yeah, that's LinkedIn's probably the best way.
Awesome. So for those that have tuned in, if you found this conversation to be really helpful, I have. There's been a lot of golden nuggets. Would you just mind sharing some love on it, engaging with it, commenting on what you felt is actually most applicable? What do you plan on applying to this? So we look forward to seeing you in the next conversation. And Ben, um, open invite to come back and to report on some of these little wins. Good
Will
stuff.
do.
It's really good to see you.
Yeah, thanks so much, Michael. This was a pleasure.
Awesome.